Okay, so Lowe syndrome is a disorder that probably affects somewhere between 500 to 1,000 children in the United States. It is a disorder that's also called the oculocerebrorenal syndrome of Lowe, and that describes the three main organ systems that are affected. Oculo, the patients have congenital cataracts. Cerebro, they have developmental delay, behavior abnormalities. Certain fraction of them have seizures early in life. And then they're very floppy, hypotonic at birth. And the renal is because they have a renal tubular defect where they leak amino acids, phosphate, and bicarbonate in the urine so that they develop serious bone disorders and other sorts of disorders if that's not treated properly by replacement therapy. So that's a disorder, and I've been working on this condition starting from positional cloning the gene, which meant finding out what is the gene involved in Lowe syndrome, not because we knew what the biochemistry was, but because we knew where it was located on the X chromosome. And by localizing it more and more narrowly, we're able to identify the gene. I developed an enzyme test for it. I developed prenatal diagnosis for it. I got molecular testing set up for it. We've been doing a lot of research, including making animal models that will be testable, but we have not pushed it over the line into is there a drug trial? What can we do to try to reverse or at least mitigate some of the serious complications? And that's what the parents have been incredibly supportive of the research. They understand that without research, we're not going to get anywhere. But they also don't want it to end with research. I mean, if my publishing papers is not their interest. Their interest is, all right, what are you going to do about Mike's son? How can I help him? So and the Lowe Syndrome Association was started by a group of mothers and some fathers, but mostly mothers of these affected boys. They're American people, no celebrities. They raise money with golf tournaments and with bake sales and with, 10-mile walks. And they work very, very hard, not just to further the research, but to support each other. They published a manual called Living with Lowe Syndrome, which is available to anybody, which is fantastic. It's better than any medical literature on Lowe syndrome. It's written by the parents. It's their observations of their children. It's fantastic. They also have inspired a similar association in England, in Spain, in France, in Italy. I believe there's one in Japan. This is not an ethnically limited disorder. It occurs ubiquitously around the world. They can treat the renal problems mostly. It requires a lot of visits to the nephrologist with constant monitoring to make sure that you're giving back enough bicarbonate, you're giving back enough phosphate, striking the balance between losing calcium, having calcium deposit in the kidneys, which can happen if you overdo it. It's complicated. It's not an easy treatment. And most of those children will eventually, by the time they're 20, 25, or 30, will develop renal failure and will need a transplant. The neurological abnormalities, other than suppressing the seizures with anti-epileptics, we have nothing. And in particular, the behavioral disorders are extremely distressing. They are a huge problem for the parents, and we don't really have any behavioral modification medications that work very well for them. For the eyes, they get their cataractous lenses taken out early in life. Then they have to have either contacts or eyeglasses for people who are without lenses, but they also have a retinal defect. So even with complete correction of the absence of the lens, there's still a decrease in visual acuity. They also have other problems with a certain fraction develop glaucoma, a certain fraction develop scarring that crosses the cornea called corneal keloids, which will block vision. So the eye abnormalities are also really only partially approachable, partially treatable.